My name is Des. I'm from Perth, Australia, and I've come to Cyprus for a Tarlov Cyst surgery. I heard about AIMIS when I was diagnosed with a Tarlov Cyst. I decided to investigate for myself because the doctors that I was seeing in Australia did not seem to be able to help me, and it was taking a long time for them to come up with any solutions. So I started to do my own research online, and I discovered AIMIS online and discovered that Dr. Feigenbaum worked with AIMIS to do Tarlov Cyst surgeries in Cyprus, and that's basically how I discovered AIMIS. I was suffering with coccygeal pain and sacral pain for at least 6 years prior to the diagnosis that I had a Tarlov Cyst. My doctor had run a number of tests. I'd had bone scans and a number of tests, and he couldn't determine what was causing the pain, and he referred me to a pain specialist, and I would go on a regular basis for injections whenever I felt that I needed them. They would never take away the pain altogether, but would sort of alleviate it to a certain degree, and then the pain would always reoccur. Last year the pain got worse. I went back to see the pain specialist, who again gave me an injection. It didn't work. From there I went to caudal epidurals, which I had 2 of. They lasted 3 to 4 weeks. The pain returned. I was also suggested to do Pilates together with a physiotherapist, which I did. We did that religiously. I went twice a week to the Pilates classes. They were one-on-one classes. They didn't seem to make any difference. The pain didn't go away, and she suggested that I see a sports physician, who I saw at, I would say, about May of this year, and he suggested that I had an MRI, and he sent me for an MRI, and on the MRI he discovered a Tarlov Cyst. He told me not to be too concerned about the Tarlov cysts. They're normally asymptomatic. When they're around 1.5 centimeters, he said to me, that's when they start to cause pain, and mine was around that size. He highly doubted that it was causing any pain, and he sort of sent me away and said he'll write a referral, a letter to my pain management doctor to ask him how to treat the Tarlov cyst. And from there, I didn't go back to that doctor. I never went back to my pain specialist, because I just felt that I was just being pushed from one doctor to the next doctor, and it was just a backwards and forwards situation. And that's why I decided to also research it myself. What made me decide to go for the surgery was I had a very bad flare-up, and I couldn't sleep at night. The pain would wake me up. My legs were burning, cramping pain. The pain that you have is almost as if you want somebody to pull your leg, stretch your leg. You cannot, well, what pain I was experiencing, I couldn't stretch my leg far enough to relieve the pain. It also progressed to perineal numbness, and I just felt that if you're starting to go numb in places, there's something not right. So when that all dissipated, it made it even all the more harder to decide that you want to go for surgery, because you feel well again. But I just had to keep reminding myself about the pain that I suffered during that flare-up, and that was my main driver for having the surgery. After my flare-up, I stopped all forms of exercise that I was doing, because I believed in myself that that was what was causing what actually caused the flare-up, after reading things online. And I totally lived a sedentary sort of life, and I found that the symptoms slowly disappeared. They didn't disappear overnight, they disappeared slowly, and not altogether. I would still have pains in my legs, I would still have tingling and pins and needles and pain in my left bottom, but other than that, I was back to what I regarded as the new normal. And I had to keep reminding myself when I climbed on the flight, the weeks before the surgery, even the day of the surgery, that this was the right thing that I was doing, because I knew that that cyst was there, it wasn't going to go away on its own, and I needed to have surgery. And the only person that could do the surgery was Dr. Feigenbaum. I decided on Dr. Feigenbaum long before having the surgery. I had investigated and found out as much as I could about him, and also working with an archivist. I had her investigate for me, because she knew exactly where to go to look to see, is this legitimate, is it not legitimate? Because you looking online, you don't know, is this what you're reading there, is it truthful? And she did all the investigations for me, and she came back and she said, no, this man's published papers and this is a legitimate doctor. So I knew that I could make the appointment, I could go through with the surgery, and that I would be fine afterwards. The point where I felt that my decision was the right decision for me was when I met Dr. Feigenbaum. Immediately I got a sense of confidence from him. I knew then that I had made the right decision, and that my life was in his hands, and he knew what he was doing. So I was very confident once I'd met him that this was the right decision. It might have been right at the last hour, last second, but I had that feeling. It arrived in the end. Had I been diagnosed with Tarlov Cyst earlier than I was diagnosed, I definitely wouldn't have waited. I would have had the surgery as soon as possible, because I felt, after reading a number of blogs and speaking to Dr. Feigenbaum's nurse, Debbie West, that the longer you leave not having any treatment, the worse your symptoms are going to become. And with nerve damage, once a nerve's damaged, is it going to regenerate to pre-damage? So I just felt that I had to have treatment as soon as possible, because the longer I was going to leave it, the worse this situation is going to get, and I might end up with worse symptoms. I would definitely recommend any spinal patients with any spinal issues, whether it's Tarlov or other, to have surgery with AIMIS in Cyprus. They take care of you, they treat you like royalty. You are not treated like a number, you feel as if you're treated like an individual, a person. I was amazed on the day of my surgery that even the finance director of AIMIS came to meet me, came to see that I was okay. The whole organization treats you as if you are a member of a family and not a paying client. You feel more like you are a member of the family. I'd recommend AIMIS to any of my family members for treatment should they require it.